Namaste, I am Dr. Payal Khandelwal, Senior Ayurveda and Panchakarma Consultant practicing in Whitefield, Bangalore. Today we will be discussing about autoimmune conditions and the treatment available in Ayurveda for the same. So let's begin. So let's understand what is the thought process of Ayurveda in treating the autoimmune conditions. Post-COVID, we have seen an increase in lot of autoimmune conditions like thyroiditis, psoriasis, multiple sclerosis, and ulcerative colitis and many more. So let's understand the thought pattern here. First, when a patient comes to us with any health issues, we identify the problem, that is identifying which imbalances the patient is suffering from. For example, we divide them into categories of Vata, Pitta or Kapha. So for example, for Vata, we will see symptoms like pain, we will see stiffness, we will see dryness, extreme level of dryness, whether it's a skin disorder or whether it is a joint disorder, whether it is a muscular disorder, the symptom category will be in under this, where we see pain, stiffness or dryness, etc. The second is the Pitta category, where we see burning, bleeding, etc. issues if it is high levels of Pitta or gastric issues, example in ulcerative colitis as well. Then the third category is Kapha symptoms, where we see heaviness, we see sluggishness, we see lethargy. So all these symptoms are mapped and we find out the imbalances in the patient. That is step 1. At the same time, we also identify if the person has ama, that is toxins. What is the toxin level in your body? Because this is an inflammatory condition. So we need to understand your ama score. How do we find it out? By seeing whether the tongue is coated, how is your digestion, because if the person's digestion and the process of elimination is affected, your gut is affected, that is 100% going to increase or aggravate your symptoms. So we have to figure out how the ama is, and also if the tongue is coated, if you are feeling very lethargic, very dull, if the body is constantly swollen up and you are not able to do your activities from time to time. There are many more parameters, but this is in a nutshell, and we map it to each and every system. Suppose ama is present more in the joints. In case of RA, we will see lot of difficulties in the movement. In case of skin disorders, if there is lot of ama in the skin, you will see blister formations and you will see various other itching, burning, aggravated. So we have to map it out. This is step 1. The second step we begin with is clearing the toxins. So if the patient is eligible, we go for panchakarma treatments depending upon the condition, like virechana, that is cleansing the body through therapeutic purgation, vamana, that is cleansing the body through emesis, that is vomiting, rakta mokshana, that is bloodletting, basti, that is medicated enemas, or we can do nasya, that is instillation of medicine in the nose. These are some of the basic panchakarma protocols that we decide and we follow. If the patient is not eligible for a panchakarma treatment, we go for Deepan Pachan, that is digestion of the ama or removal of the ama from the subtle channels of the body, so that the inflammation, the discomfort of the patient comes down. This is very important. So we are not suppressing anything, we are actually mobilizing the toxins away from the body, which is a core concept of Ayurveda. The third is matching therapies to the dosha patterns. Like I said, the panchakarma therapy can be decided on the symptoms, on the condition of the patient. For example, if it is vata predominant with lot of pain, lot of stiffness, then we can do medicated enemas as the first line of treatment. Basti treatment helps very nicely in treating the patient. The second is, if the patient's dosha pattern is pitta, that is heat element is more, we think about virechana as the first line of treatment, which helps in removing the inflammation, reducing it, and also in reducing symptoms like heavy bleeding or burning sensation in the body. And the next is for kapha, that is we do vamana treatment, which helps in reducing the lethargy, the sluggishness of the body, and helps make the person more active. Now the next important step is we support the digestion and the diet, and also give a complete lifestyle regime to the patient, because always remember, only giving medications or doing treatments is not enough. What if the patient is not having a good lifestyle? If he is having bad lifestyle, for example in a pitta person who has, let's say, multiple sclerosis or psoriasis, and he is staying up late night and he is eating junk food, he is not exercising properly, so many things can add up and aggravate the symptoms. So we have to correct the lifestyle, advise the patient that these lifestyle changes are important, these food changes are important. This season you may feel the symptoms aggravated, so please take care of your food. The food has to be aligned. There is something called as daily regime, dinacharya, and seasonal regime, that is rutucharya in Ayurveda, which we have to advise correctly, and then it becomes a holistic approach, and that is which helps reducing the flare up of symptoms. Most important is working on the stress also, sleeping on time and working on stress by doing meditation, yoga nidra, pranayam, etc., which help in reducing the cortisol levels in the body, the stress hormones, and also in giving better results. And the next step which we do is rejuvenation with rasayan therapies, that is medicines which help in preventing further complications in the person. And the last step is we integrate with modern care. In case the patient has come to us with dependent steroids or any other dosages, we do not stop it abruptly. We work in collaboration so that we can give maximum health benefits to the patient. If we see the protocol in terms of weeks, the first week we are going to work on identifying the imbalances and work on repairing it by clearing the toxins in the body. Week 2 to 5 mostly we finish our Panchakarma treatments. Week 5 onwards till week 6 or 7, depending upon the symptom flare up and the reduction, we discuss about everything lifestyle regime, which we start from day 1 obviously, and the last protocol after week 6 is maintenance therapies, which will be on rasayan, that is regenerative medications, immunoboosters, which will help in balancing the doshas in the body. Thank you so much.